Hi everybody, welcome to the second part of our integumentary system lecture. So last time we talked about the integumentary system in terms of your two main layers of the skin, which is dermis and epidermis. We talked about the 5 branches of the epidermis, or sorry, I should say 5 layers of the epidermis, and we also talked about the 2 main layers of the dermis. Now we're going to take a look at some of the factors that help our skin tone. So one of the things that actually contribute to our skin tone, and I have mentioned it in the previous lecture as well, is melanin. So melanin is a color pigment produced by melanocytes, and it is one of the color pigments produced, but it does contribute significantly to your skin tone. But I also mentioned that melanin is produced as a defense mechanism when you have a significant exposure to UV rays. So let's understand this, and I want to make sure that it does explain it here. So it's not in the PowerPoint, but please pay attention. You are required to know this information. Ultraviolet light, which is also shorthand to UV, there are 2 types. UVA and UVB. So both can cause damage to our skin, and I'll talk about that in a little bit more detail. But the more dangerous of the 2 is the UVB. So most of the sunscreen or sunblocks we have are targeted by absorbing the UVBs and limiting the danger to our cells or our skin cells. Now, normally, we already have this defense mechanism within us. And that's, again, your melanin protecting your keratinocytes DNA. So let's backtrack. Most of your skin, or most of your epidermal layer, is made up of keratinocytes. These keratinocytes have nucleus, and their nucleus contains DNA. If this DNA gets targeted by the UV rays, there can be mutations, and that mutations can develop to a much more severe conditions like cancer. So the way your body is going to defend itself is melanocytes are going to produce melanin and pack them into these little granules. These granules then travel from melanocytes into your keratinocytes, and they form this kind of a shade or umbrella over the nucleus of the keratinocytes. What is the goal of this again? Is to protect the DNA of your keratinocytes against the UV rays. So these melanins are going to absorb your UV rays. Now, please do note that when you go to the beach or when you go to a tanning booth and you get that beautiful tan, what you're actually doing, or what your body is telling you, is that you have put me at risk. You're already forcing me to kind of go beyond what I was normally doing and produce a significantly higher levels of melanin to try to protect myself against the UV rays. But usually, again, when you start to have the tan, the damage has already happened. What you're trying to do is just prevent that damage to go any further. Now, I have a link down here. I'm not going to click on it because it's going to skip my screen. But please, when you guys get a chance, go back to your PowerPoint and click on the link and look at a really good overview and animation of what I just explained to you. Now, please do note that people who have fair skin tones, they typically produce less melanin, and that makes them more susceptible to UV rays and skin damage as well as skin cancers. People who have darker color, they already have a higher level of melanin in their system, and therefore they have a higher protection or better protection against the UV rays. Does it mean people with a darker skin tone are fully protected? The answer is no, but they're definitely more protected than somebody with a fair skin tone. Quick note, what we identify as freckles are basically pigmented moles that are happening as melanin gets accumulated in a specific location within the skin. Now, some of the damages that could happen to your skin as a result of overexposure to the sun. One, as I mentioned, is elastic fibers losing their elasticity or their recoiling ability, and that causes the skin, sorry, not losing their elasticity, losing their, I should say, they clump up together. That's the word that I need to use. They clump up together, and that makes the skin a lot more leathery. We also have, of course, loss of the elasticity over time, which could be more severe in case of people who are sun exposed. You have a decrease in the production of folic acid because UV rays are actually destroying the folic acid. Now, this is not as dangerous to a normal person or a healthy individual. However, if you are pregnant, that could cause an insufficient amount of folic acid in a pregnant woman, and that can cause damage to the developing embryo. So a lot of time, if you notice, if you are pregnant or getting pregnant, one of the things that they strongly recommend is increase the intake of your folic acid. This affects the nervous system development. The other thing which we already talked about is UV rays can cause alteration in your DNA. It can lead to mutation, and that mutation can eventually develop into skin cancer. We also have people who are photosensitive. When they are exposed into a sunny environment, some drugs, not all of them, but some antibiotic, some antihistamine medication can cause photosensitivity, and those photosensitivity combined with exposure to UV rays can lead to skin rashes. Now, let's take a look at some of the accessory structures that are found inside your dermal layer. So let's start with hair. So hair actually does have functions, not just to make you pretty. So one of the main functions is to protect you against heat loss. So you kind of think about the hair on your head. If you don't have it, you have a cap. A lot of people have cap. Again, it prevents you from getting rid of a lot of the heat. So very similar to the subcutaneous layer of the skin. It also guards you against physical trauma. So the thicker the hair is, the less chance of physical trauma. It also shields your skin against sunlight. So some of that UV rays can be removed when it reaches this, before it reaches the skin actually. So another word for hair is pili. So what is actually hair made up of is strands of dead keratinized cells. However, this keratin is slightly different from the keratin found in your skin. The keratin in your skin is soft, whereas the keratin in your hair is hard. So that difference basically makes your hair more tough and more durable, but at the same time more flexible. So in terms of your hair, these cells, because of that hard keratin, they don't flake off. So you basically don't want, as you run your hand, let's say, through your hair, that little pieces of your hair fall off, right? Like your skin does, right? So that top layer of the skin easily falls off, but in terms of your hair, by running your hand through your hair or brushing your hair, those cells do not fall apart. Now, when we look at the hair, again, we have hair growth, which means there must be a region where you have actively dividing cells undergoing the process of mitosis. That region is referred to as the hair matrix. You have, and we talked about that earlier, we have a structure or a muscle called erectile pili or pili, which is responsible for contracting during excitation or stress, causing the hair to stand up, giving you that whole goosebump feeling. We actually have two main types of hair. These are identified as vellus versus terminal hair. So vellus is typically what we identify as quote unquote baby hair. These are really pale, really fine skin, fair hair that grows throughout the body in children and in some cases adult females. On the other hand, opposite of what we identify as vellus or baby hair, we have terminal hair. Terminal hair is really coarse, gets long, it's pretty tough. It is found in the scalp and eyebrows, so you can actually kind of go through that and you can see the thickness of the hair. When male hit puberty, they start to grow this hair in their face and their neck and their armpit area for women as well as the pubic region for both sexes. Now, we have seen this, not we, I guess I should say, a lot of time you may have heard the word alopecia. Alopecia is basically referred to as thinning of the hair that typically happens when people reach age of 40. It does happen in both cases of male and female. This is different from what we identified as baldness. Baldness is, or true, I guess I should say, true or frank baldness is actually typically identified as a male pattern baldness or associated with the male gender. It is a sex-influenced condition, so it is actually an X-linked genetic condition. So women are usually not susceptible to it because they have 2 copies of the X versus male only has 1 copy. If you have no idea what I talked about, the X and Y, that's okay. As far as you remember, it is sex influence or sex gene related. So male pattern baldness is a result of a hormone called DHT or dihydrotestosterone. What this hormone is a form of androgen, which is a precursor to sex hormones. Now, what does that DHT do is it causes the hair follicle to shrink, so it gets smaller. It also decreases the cycle of the hair growth. So a hair typically undergoes a cycle, and I don't think I actually have this in my lecture, but it undergoes a cycle of basically growth, I guess it grows and it stops, then it kind of goes to a sleep, quote unquote, and then recycle, and the cycle starts over again. So not all of your hair follicles are basically continuously active, they undergo a cycle. Now, this cycle of growth typically is much longer than the cycle where the hair is basically not growing. In a case where you have an increase in DHT, this cycle of growth is significantly shortened. So you have a shrink of the hair follicle, which makes the hair more susceptible to falling, and you also have a shorter growth period within the cycle of the hair. Both of these lead to what we identify as male pattern baldness. And again, there are solutions to this. We always talked about hair implants nowadays. There's really common. Taking Rogaine helps also increase the chance of hair loss. But again, this is a genetic condition, which is something that you cannot 100% control via diet or changing the lifestyle. Now, some of the conditions you can see again related to hair is basically thinning of the hair for one or multiple factors listed here. You can have, in some cases, this is really rare, if you have high fever for a short period of time that can cause significant damage to the hair, and basically you cannot recover from that, or that leads to hair thinning. Sometimes the side effect of surgery is hair thinning. Emotional trauma, fluctuation in hormones that are basically helping you deal with that emotion, can lead to thinning of the hair. Antidepressant medication, steroid, chemotherapy medication, blood thinners, which are basically taken for people with hypertension. These are all can lead to thinning of the hair. A lot of people, if they are protein deficient in their diet, which include a lot of people who are vegan, they might be also deficient in terms of, their hair may start to thin out because of that deficiency. You have hair loss that might be irreversible because of radiation or chemotherapy. And then you have what we call alopecia areata, which is where your own immune system, it's an autoimmune disease, where your own immune system attacks your hair follicle and causes damage to hair follicle, causing the thinning of the hair. Next, we have your nails. So one of the things to note, again, if a structure grows, means those cells are, some cells within that structures are undergoing mitosis. So in this case, like your hair, your nails also have what we identify as a nail matrix, which is located at the base of your nail, protected by your epinecium or your cuticle. This region of the nail matrix, or the region called nail matrix, undergoes what we call mitosis, and is responsible for nail growth. We have the nail bed, which is basically the epidermal layer where your nail lies on top of. So here in that pink layer right here, that's your nail bed. And then again, epinecium, or what we identify as cuticle, are the little folds of the skin that covers the edges of your nail. Really not much to talk about when it comes to nail. However, do note that a lot of the changes that happens internally can affect the health of your nail. Now, sweat gland. Sweat glands, also known as sudoriferous glands. These glands, as I mentioned, there are two major types of them. They're called acrine and apocrine sweat glands. They are found, if we're talking about a typical sweat glands, they're found throughout the body with the exception of certain parts of the body. And again, I'm going to go into that in just a second. The average sweat glands in each person is about 3 million per individual. So let's go ahead and take a look at the first type of gland, called the acrine gland. So acrine gland is the most numerous type of sweat glands we can find in our body. Why are they so numerous? It's because they're essential for thermal regulation. So basically, when you start to heat up, your body says, what is the best way to cool down? You sweat. So these are found significantly at higher concentration in the soles of your foot, the palms of your hand, and your forehead. 99% of what you release from these sweat glands is water, and you also have vitamins, you have microbe killing, which is again that antibacterial component, you have metabolic waste, you have antibodies, and very little peptides. Now, really important to remember, guys, this sweat does not necessarily have a smell with it, which means basically when this sweat dries up, you really, that's it, it's done. 99% water, so really there's nothing added into it. Really cool fact about this, I read somewhere where these acrine glands get activated based on the location you were raised. So let's say if you were raised in Southern California, where you deal with the heat and you sweat all the time, the number of the acrine glands that are active and basically help you thermoregulate is going to be significantly higher or more numerous compared to somebody, let's say, living in East Coast where they have really cold winters. So because their body doesn't need to regulate body temperature through sweating, they do not activate or engage as many sweat glands. So if somebody moves from the East Coast to the West Coast, let's say in the summer, they would feel the heat significantly more compared to somebody who grew up here. Not because they're more sensitive, is because their body is a little bit off in terms of thermoregulation. They cannot produce enough sweat to help them cool down. Another cool fact that I like to remind the students is that when you sweat, and you probably have kind of observed that if you do activities. So when you start exercising, your sweat typically starts from the face, and as you start to intensify your activity, then you see the other parts of your body sweat, right? So your body doesn't say, oh, I need to thermoregulate, and every apocrine gland in your body starts to release sweat. It basically says, okay, I have little thermoregulation, so I'm going to start with sweating in my face. If I need to activate more, my arms starts to sweat, and going down my chest, and then eventually my legs. So not all of the apocrine glands get activated at once, which I think is really cool. Here, a histological feature of the apocrine gland. You can see the little dots that are present inside the apocrine gland. Now, opposite of the apocrine glands, you have your apocrine sweat glands. Apocrine sweat glands are extremely important in terms of producing that kind of the yellowish, milky color sweat that is odorous in most cases. Now, what is the reason that sweat is odorous? It is not the sweat itself. So when the sweat gets produced, you have added fatty substances and proteins to the sweat. So when this sweat reaches the surface of the skin, where you have a significant number of bacteria living on, these bacteria see these fatty substances and proteins as their nutrients, as their food. So they start to break down those components. Now, as they break down those components, they produce the byproduct, and that byproduct is what makes the body odor. Now, the apocrine sweat glands are not as active before puberty. They do get activated mostly at puberty, and they are concentrated in the axillary region, basically your armpit and the genitalia and around the nipples. There, as of right now, there is no quote-unquote known function associated with that, but some people say that it is associated with basically sexual tendencies in terms that it acts as quote-unquote pheromones. Now, we have modified apocrine glands that are found within our ear, producing earwax. They call ceruminous glands, and they're also found within the female breast or mammary glands, and they are producing and secreting milk. But do note that the secretion of the milk from the mammary glands are under the control of hormones that you will learn in reproductive system. Sebaceous glands or oil glands is another accessory structure we have within the dermis. They are spread and distributed widely through the skin, especially where you have the hair. So again, those oil glands are the more hair you have, the chances are the more oil glands you have. They are not present at the thick skin, which is the palms of your hand and the soles of your foot. So you don't naturally produce oil within your soles of your feet, let's say. They are typically very inactive or relatively inactive in children until they reach puberty. They do get stimulated through the hormonal release, typically sex hormones, and to produce what we identify as sebum, which is basically the oil. This oil does have bacteria killing or bactericidal properties, which is essential function of your integumentary system. Now, if these sebaceous glands cannot release their oil to the surface of the skin because of the blockage, we form something called a whiteheads. If the oil inside the whiteheads starts to oxidize, which is a chemical reaction, they turn to what we call blackheads. Now, if the whiteheads, which is basically a bunch of oil under your skin, gets infected, then you have inflammation as a result, which is basically swelling, and that's what we identify as acne. Here is a depiction of, again, your apocrine glands. These pictures that you have in the textbook do not contain the apocrine gland, but they are, again, relatively larger than the apocrine glands. And then you also have your oil glands connected to your hair follicle. So one of the last things that I want to talk about is skin and protection. So what are the protections that we have? We mentioned this over the lectures, but we're just going to put them in one place. Skin protects against chemical. I guess it is a chemical barrier. I shouldn't say it protects against chemical. It is a chemical barrier. Your sweat glands and your oil glands produce and release antimicrobial component to the surface of your skin that helps destroy it. You also produce melanin, which is a protein, and that protects you against UV radiation, more specifically UVB, which is the more dangerous one. Your skin acts as a physical barrier. You literally have layers upon layers of flattened keratinized cells stacked on top of each other that is not only a physical barrier, but also prevents water loss. You also have skin as a biological barrier. Your epidermis prevents bacteria from getting in, but let's say if something got in, you do have phagocytic cells, which are basically your immune cells that are going to engulf any foreign material or invaders and basically chop them to little pieces. Now, last two concepts are medical conditions, which is one is a skin cancer and the other one is a burn. So for a skin cancer, we have what we identify as three categories. First of all, if you use the word benign, it basically means that it's not cancerous. There are tumors, but they're not cancerous, versus if they are metastatic, which means those cancers, sorry, not versus, but another word that we use in terms of skin cancer is, do they have the capacity to metastasize, which basically means, can they spread to the other parts of the body? Now, we already talked about a skin cancer in terms of UV rays. Again, overexposure to UV radiation, specifically UVB, can cause significant damage to your skin. Frequent irradiations of the skin, irritation of the skin can also cause a skin cancer. There are lotions on the market that can help you repair damages to the DNA, but again, nothing is better than trying to prevent or protect yourself against the UV rays. Before I go into the three types of skin cancer, I wanted to take a moment and go over one quick concept with you guys. Even though we say that the UV rays are bad for you, they can cause a skin cancer, please do note a few points. Some UV is required for your skin to convert cholesterol to vitamin D. So your skin cannot convert cholesterol to vitamin D unless UV rays are present. So a small amount of UV rays is acceptable, your body can deal with it, and it also helps produce vitamin D. But if you have, again, overexposure, then that's where the damage can be severe and irreversible. Now, going back to the 3 types of cancer. We have the least dangerous cancer, which is basal cell carcinoma, followed by a cancer, skin cancer somewhere in the middle, which is the squamous cell carcinoma. And then lastly, the most dangerous of the 3, called melanoma. So briefly looking at each of these, basal cell carcinoma is the least dangerous. It is affecting people who have typically a fair skin tone and have significant exposure to UV rays. They appear as little tiny pink domes, and they don't metastasize very rapidly. So there are people that have basal cell carcinoma for years without having that metastasized. It is, I would say, most cases, I say 99% of the cases, the removal of basal cell carcinoma is performed as an outpatient procedure where they basically go in, they make a small incision, remove the cancer, basically put a bandage on it, and have the patient leave. So again, it's very simple to treat and nothing significant. It is originating from the stratnum basal, which is the bottom layer of the epidermis, the one where is responsible for mitosis. The second type, which is more dangerous, is your squamous cell carcinoma. Why is this more dangerous? 2 reasons. First, it can metastasize if it's not treated, and it can be treated by radiation, but it takes a while. Now, typically, again, the way you can identify squamous cell carcinoma is that it appears as kind of a scaly, reddened papule on the skin, your lower lip, the ears, again, mostly localized in the head. And the target of the squamous cell carcinomas are going to be a layer of your epidermis called a stratnum spinosa. Now, as I mentioned, a squamous cell carcinoma can be treated by radiation and then removal of the cancer through surgery. However, if people ignore it, it does metastasize to other parts of the body, and the chance of survival significantly decreases. Now, again, this type of cancer is also related to people having a higher level of exposure to sunlight. So if you have fair skin tone, you're more susceptible to this type of skin cancer. Last type, which is known as melanoma. So the target of these are not your keratinocytes, rather than your melanocytes. This is the most dangerous skin cancer we have. A main reason for it that it can metastasize pretty rapidly, and the unfortunate news is that it is resistant typically to treatment. So mostly is your goal is, if you do have melanoma, you want to remove it as fast as possible before it can metastasize and cause more damage. What are the rules for identifying melanoma? Melanoma detection rules is literally A, B, C, D. What are you looking for in a melanoma to identify it? A symmetry. So typically when you look at this, the pigmented color does not match on either side of the melanoma. So it doesn't have a consistent color. Irregularity in the border, so B for border. It does not have the typical kind of a circular pattern that you would have seen in terms of your basal cell carcinoma or a typical mole. Your color. These colors actually range from black, brown, tan, red, or even blue. Blue is not very common, but the black and brownish color are the most common type of melanoma. D, diameter. And the larger than 6 millimeter is basically the size of a pencil eraser. That's something that you really have to be concerned about. Again, the larger the melanoma is, that basically means that has been there for a long time, and the chance of it has reached other parts of the body is pretty high. So when I talk to my students about melanoma, I always tell them to, when you see something growing different than your original skin tone, and it matches this characteristic of A, B, C, D, go have the doctor take a look at it. You know, worst case scenario, you guys have, let's say, wasted some money, and I put that in quote unquote, going to see a doctor about a mole, and it turns out to be a mole. But again, it's much better to catch this cancer sooner than later, and make sure to get it treated as fast as you can. The other thing I want to mention about melanoma, which is some people overlook it, is the fact that it is randomly starts. So it has nothing to do with, well, not completely. It doesn't correlate to only fair skin. People who have darker skin tones can still get melanoma. Just because you have a darker skin tone does not exclude you from this cancer type. It does get randomly started, and it does affect all groups of people with different skin tones. Last thing, let's talk about the 4 main types of burns we have in the body. Now, burns are identified as basically damage to your epidermis and dermis as a result of either electricity, heat, or radiation. Some chemicals can also cause significant damage, like your acids and bases. These damage can cause denaturation of your proteins, which basically proteins means they fall apart, and that can also destroy the cells. Now, typically, when you have a burn, one of the main things you want to deal with is make sure you treat any possible dehydration as a result of the burn. Typically, it doesn't apply to the 1st or 2nd degree burns. It's more for severe burns. Make sure to address the electrolyte imbalance, because again, when you have a burn, the chances are you have lost a significant amount of water, and with water, a lot of those electrolytes like sodium, potassium, chloride, etc. Why do we want to address these two first, dehydration and electrolytes? Is because if the dehydration is severe enough, it can cause your organ system to shut down, mainly your renal system, which are your kidneys, and your circulatory system. And both of these systems shutting down basically means the person is going to die. How do you evaluate your burns? We have these rules of 9s that are used. So basically, body is broken down to 11 sections, and they typically come in a number of 9. So I'll just show you a picture. So the anterior of your body is 2 9s, so 9 and 9, 18, and then 18 for the posterior aspect or posterior part of the trunk. Each of your arms are 9%, front is 4.5, and the back is 4.5. Your legs are each 9%, which if you, and then, sorry, your head front is 4.5, back is 4.5. Typically you said, and the neck is about 1% sometimes, depending on which one you look at. So sometimes the numbers are slightly different. This is usually used to kind of get a very general idea about what degree, so not what degree, what percentage of the body is burned for each of the type of burns that we have. The only thing that is not included in this diagram is that the genitalia area considered 1%. So that's added, bringing you up to 100%. Now, what are the type of burns we have? So the typical 3 type of burns you hear about is 1st degree, 2nd degree, and 3rd degree. Both 1st degree and 2nd degree burns are identified as partial thickness burn, which basically means both either epidermis or part of the dermis are burned, or damaged. First degree burn, the extension of the damage is only to the epidermis layer. That's a typical sunburn that you see. You have, or even touching something hot. There is no blister, there is local redness, there is swelling of the tissue. Of course, there is pain. So the nerve damage, the nerve endings still feel that change in the environment, right? So first degree burn doesn't really have a main treatment. You don't usually go to a doctor for it. You just basically take typical burn cream, aloe vera gel, etc., and wait for the burn to heal itself. Again, a very common type of first degree burn is you touching something hard, sorry, not hard, something hot, or a typical sunburn. Second degree burn is different from the first degree burn because we start to see blisters. So you have edema, you have redness, and you have development of blisters. For second degree burn, you have already gone through the epidermis and you have partial damage to the dermal layer as well. Again, there is no major treatment for a second degree burn unless you have it in very specific scenarios. It can heal on its own, work on a burn cream, keep it cool, and basically the burn is going to heal itself over time. Third degree burn, which is also known as the thickness, entire or full thickness burn, is where you have burn both through the epidermis and the dermis layer. This type of burn usually appears as gray, white, cherry red, or blackened, depending on the location of the tissue and how it was burned. There is no swelling in the tissue. There is no water, basically. That whole water is evaporated. There is no initial pain, and the key word here is, guys, initial pain, because the nerve endings have been completely destroyed. So there is nothing to actually feel the pain. Really, really important, guys. When we're talking about nerve ending removed, so if this person is surviving a third degree burn, when the body starts to heal itself and those nerve endings starts to come back, these people feel excruciating pains, right? Because their basically bodies are starting to know what has happened to them. So a lot of time when these people are starting to heal, if they have survived the initial burn, they actually put them in an induced coma to help them basically kind of alleviate some of the pain. In a third degree burn, you do require almost uniformly some sort of grafting, which is basically means taking a piece of a skin and placing it where the burn took place. We have what we identified as allografting. Allografting is when you take a skin from another person and put it on the burn victim. And we have what we identified as autografting. Auto means self, so autografting means the skin comes from the same individual who has the burn, basically the patient. So they take the skin from a different part of the body and place it on the damaged area. Now, I didn't include a fourth degree burn, but I do want you to know it for your exam. So fourth degree burn, fifth degree, and sixth degree burn, sometimes they mention those. Basically, these burns are when you have burned completely through the epidermis, through the dermis, and you have damaged the tissues that are underneath that, which includes the muscle, the tendons, and the bone. Usually, if you have a fourth degree burn, or fifth or sixth degree burn, you actually can see the muscles and the bones underneath this. Now, at this point, there is not much that they can do in terms of healing the damage. In many cases, they end up amputating the section that has the burn because they basically, it's dead tissue. They can't really do anything with it. Again, these people initially at the location of the burn won't be able to feel anything because all of that tissue has literally nothing left in terms of nerve endings. So again, remember for the 3rd-degree burn, the grafting or allografting as well as autografting. Make sure you guys can distinguish the two types. What we identify as critical. You can have 100% burn on your body, but that burn can be 1st-degree burn, and you'll be just fine. Basically, you have a sunburn. But what we identify as critical is if you have more than 25% of your body has a 2nd-degree burn on it. So basically, you're covered with blisters, red tissue, swelling, all of that for over 25% of your body. What we identify as critical also is when you have 3rd-degree burn in 10% or more portions of your body. It's really good to remember that you have to, whenever you think about burns, it's not only the degree of the burn, but also the percentage of the burn over the body. So a person, I just want to give you an example. A person, let's say with a 3rd-degree burn on their or 4th-degree burn on their leg may be able to survive because they can amputate the leg and the person can recover as a result of the treatment. But somebody with a 3rd-degree burn over 4.5% of their body might die as a result because the burn might be localized to their head, right? So it's the location is also something else that you do need to think about. Now, what are the common treatments for burns? Again, we mentioned that already. Debridement is one of the main ones. Basically, you want to remove any tissue that has been damaged as a result of the burn. Typically, you want to always remember that if you have tissue that's necrotic or damaged, you must remove that before that enables your healthy tissue to start healing. For the 2nd-degree, for the 3rd-degree, 4th-degree and above, if the person, you have to give this individual, your patient, antibiotics. The antibiotics is a must because you basically don't have a barrier between the outside and external environment and the internal environment. So all those bacteria that was used to live on the surface of your skin now have direct access to your internal structures. So sepsis is a really big issue with burn victims. If you have ever been to a burn unit, they are extremely careful as far as what they wear and who comes into contact with these patients, because basically they are very easy to contract an infection and as a result develop sepsis and die, consequently die as a result. They do have temporarily covering on the tissue that is burned. There are, of course, a skin graft that I mentioned earlier as well. There was a research recently, or maybe not recently, a few years back, that they were showing a significant result with using fish skin, tilapia fish more specifically, or tilapia, to basically heal or help the healing process of burn victims, which was really interesting. So that's about it for our integumentary system. So thank you for watching the video. Make sure you guys complete the rest of your assignments as well.